Good evening, everyone. My name is Jean Sanchez. I'm the Senior Event Manager with Empire Medical Training. Thank you for joining us in today's webinar. We're gonna talk, the topic for today is gonna be the HAIRestart with Dr. Claudia Theodoro. Let me introduce you to Logan Reese, who is the Sales Manager for Fotona. Good evening, Logan. How are you?
Good evening. I'm great. How are you doing?
I'm very good. Thank you for asking. Thank you for joining us tonight. Very excited.
Thank you for having us again. We are excited to be here again. I can't even remember how many we've done now with you guys, but we've just really enjoyed our partnership and, look forward to another one with Claudia tonight. So before I introduce her real quick, for those of you who aren't familiar with Fotona or what we have to offer, give you a little background on us. Fotona is actually the oldest medical laser manufacturer in the world. We've been building lasers since 1964, which is only 4 years after the laser beam was invented. So we've really been doing this for a long time, and over the past 50 plus years, we've really built a strong reputation across the world for our innovation and award-winning laser systems in aesthetics, dermatology, gynecology, surgery, and dentistry. And what really makes Fotona unique is that we actually build all of our laser systems handmade in-house. So every system is actually handmade in-house, and this just ensures that all of them are built with the highest quality, the highest reliability, and the highest durability. And so we really pride ourselves on that. We pride ourselves on being innovators and just building a strong Fotona family, as we call it here across the world. And one of our dearest friends I'm excited to introduce you to tonight is also an old friend of Empire. So a lot of you might already be familiar with her. She's a trainer for Empire, does a lot of the laser courses, and that is Ms. Claudia Theodoro. Claudia is the owner and manager of Manhattan-based Laser Spa Bare Body Laser and Aesthetics, and she serves as a per diem clinical trainer for many laser companies. And for more than 15 years, Claudia has been offering her clients the most advanced skincare procedures available on the market, using multiple devices and systems provided by multiple medical aesthetic device companies. So Claudia is recognized for her vast knowledge of laser physics, skin assessment, anatomy and physiology, laser safety, risk factors, and aftercare, contradictions, and unique protocols. If you have any questions about lasers, Claudia is certainly the person to ask, and we're excited to have her tonight. So without further ado, Ms. Theodoro.
So hello, everybody. Good night.
Hi, Claudia. How are you?
Hello, Jean. How are you?
Very good. Very, very happy to have you again.
Yeah, I miss you. Haven't seen you in a long time.
I know. It's been a while. It's been a while, but we are very happy that we are doing this webinar with you tonight.
Thank you. I'm very happy to be here with you guys as well.
Would you like to talk a little bit about yourself to the audience?
So I think, like Logan said, and like everything, Fotona is my latest, purchase. It's my little baby. It's right here beside me. So I'm very excited with the device. Very excited with the protocols. What I'm going to present today is a protocol that is off-label. It's on the process of the FDA, so it's very important. That's the beauty of Fotona. We have a lot of things that we're able to play around, and with really good results. I know Fotona I'm Brazilian. I'm from South America, very well known in South America, well known in Europe as well. And I ended up adding it to our practice, and I'm very happy with it and very happy with the results. And I'll be able to share with you guys a few results with the Fotona.
Fantastic. So with no further ado, let's just start this.
Yes.
Thank you.
I'm going to start sharing my screen here.
And also let me remind everyone, if you have any questions for Claudia, please, on the bottom of your screen, you have an icon that it says Q&A. Submit all your questions there, please. Do not submit your questions on the chat because we will lose track. All right? Thank you, Claudia, and everyone enjoy.
Okay, guys, so tonight we are going to speak about what we call the hair restart. So it's an innovative hair growth using erbium laser. So it's an epidermal superficial thermally activated reaction of tissue. Guys, I'm sorry, like I'm a little new with the Zoom hosting. So we're going to talk about the introduction, the understanding about the spectrum of light, hair cycles, and hair loss and causes, measurement and diagnosis, therapy options, and in the end, we're going to talk about the Fotona HAIRestart and showing you guys some of our cases, and then we're going to go to the conclusion. So we're starting here with our dear president, showing that he was speaking how important it is for a man not to get bald, which means there's a big market out there for this treatment. So alopecia, the market size is estimated in a growth of 12.37 billion by 2025. Over 80 million men and women suffer from hair loss in the US alone. About 85% of men are projected to have thinner hair by the age of 55. Approximately 21 million women suffer from severe hair loss problems, with 40% undergoing treatments. So as you guys can see, it's a very big market. And on the hair and the laser market, this is a device that's unique. I have many other devices, and nothing equals to the technology that what Fotona has in different fields, but this is one of them that I'm very impressed with. Okay, so we're going to start with the spectrum of light. So we have from ultraviolet up to infrared, all different wavelengths. And it's very important to understand that's electromagnetic waves. So you have magnetic field and you have the electric field, okay? When we're looking for a wavelength, we are measuring from one peak of the wave to the other peak of the wave. And as we can see here, larger the wavelength, okay, less energy it has and deeper it goes. So for example, gamma rays, you see they're very short, but they're very ionizing, okay? It's a lot of energy there, even though it doesn't go as deep. And when you go to the radio, you see it's very long. It doesn't have as much energy, but it penetrates very deep. This is another way to look at it, and it's showing like how much of the size of a wavelength from the gamma to the TV and radio. And what we're going to talk today, these are different wavelengths and different lasers, different depth of penetration. What we're talking today is about NdGag 2940, okay? And there is some protocol adding 1064 as well to this protocol. So we have 4 phases of hair growth: catagen, anagen, catagen, telogen. The exogen, it's usually part of the telogen. Most people don't talk about it. So the hair cycle, the anagen phase, it's a growth stage. The cells are nurtured by blood vessels, and it's pushing the hair up to the follicle. It lasts about 2 to 6 years, and about 85% of the hair on the scalp are in the anagen stage. So then we have the catagen stage. Traditional stage, slightly loose of color. The hair follicles shrink, detach from the blood supply. It lasts about 2 to 4 weeks, and it's about 1 to 3% of hair are in the catagen stage. Then we have the telogen stage. It's the resting stage. Follicles remain dormant 3 to 5 months, and about 10 to 15% of the hair is on the telogen stage. So this is how the cycle works. We get the anagen stage about 2 to 6 years, and then we get into catagen phase for 2 to 4 weeks. Then we go to telogen phase for 3 to 5 months, and then the whole cycle starts over again. So that's the nature of every hair, is to grow and fall out. It's going to be varying from different parts of the body, but here we're talking specifically from the scalp. So these are type of structures of hair. So this is a negroid, so it is, you can see the difference of structure. Then we have a Caucasian. And here we have a Mongolian. And here's are the structures, the format. So if you can see, it's oval, elliptical, and cylindric. So as we could see here. So you have the shaft of the hair, it's going to be different depending on the type of hair. And that's the hair growth structure. That's how it looked like. So in this case, it's perpendicular and the other ones are obliqual. Okay, so we have different types of hair loss. I listed them all here, but the main one we're going to talk about is androgenic alopecia, also hereditary hair loss. If they're individual, they are sensitive to a hormone called DHT, and that's what we mainly are going to talk about it, even though we have all the list of different types of alopecia. How does the hair loss is the process? So here when you have a thick, healthy hair, the hair starts getting loose, thinner, shortened, and losing pigment. And then it starts fading and fading, and it becomes into a vellus hair, and that's how it goes. So when anybody tell you guys and ask you, was like, oh, but shave makes hair coarse. That's a myth, because if that were true, bald guys will have the solutions for their head. Just shave it. It's hormonal. So the only thing when we shave or we trim the hair, we're just cutting the thin edge of the hair. Okay, so here we have the factors of hair loss. So deficiency of vitamins and minerals, temperature, stress, digestive system, use of medication, certain hairstyles, and genetic predisposition. Again, we don't need to be slaves of our genetics. So it's ways for us to compensate there in other ways. So it's important to understand that. About 70% of men versus 25% of women have hair loss issues. And I can tell you guys that they're more compliant in the treatment than women, believe it or not. So hair losses causes connection between nutrition, hormones, intestine, hair, and inflammation. So Hippocrates in 460 BC identified that the factor of he's a father of the Western medicine. He notices that eunuchs never went bald. So in 1942, Hamilton confirmed that connection between testosterone and androgenic alopecia through a study that there were 104 castrated prisoners, which for some type of crime, they got castrated and they wouldn't get bald, and they start injecting these prisoners with testosterone. And as they did, the prisoner starts getting bald. So that's how he could prove what the testosterone role on the androgenic alopecia happened. So androgens normally stimulate terminal hair production for many types of the body, but on the scalp is different. It actually makes it fall out. In the follicle, the circulation male hormone testosterone is converted by 5 reductase enzyme into the DHT. Aside of DHT, we have prostaglandin D2, also inhibits hair growth, and it's elevated in bald scalp of man on androgenic alopecia. Nutrition deficiencies. It's very important to bring this up because when you diagnose a patient, it's very important for you, and I'm gonna show you guys a panel that we start doing in the office before we start treating any clients for hair loss. because we need to understand their nutrition deficiencies, their minerals, their vitamins, their hormones, because we just don't want to treat it and make that hair growth, but we want that hair to stay, right? And improving their nutrition and hormone levels and etc., we're able to hold that in a more healthy tissue. So here we have some studies showing the role of micronutrients in alopecia areata. So there are medical studies proving that, which what I want you guys to understand is the role that's important to play. We are not just a head, we are a body, that it's all connected. So in order for the hair to function healthy, the rest of the body needs to be healthy as well. So this is a study showing that alopecia patients after fecal microbiota transplant, so their gut, look how impressive this is. And you know, like the Chinese medicine, the health starts from the gut. So there you go, how important this is. And again, showing the scalp, the follicle biology, the disease. So, and then we go to another situation, inflammation, so microinflammation. So we have systemic inflammation in our body as well that we should address in order to be treating this patient, which is very difficult because of a lot of people's lifestyle, what they eat, the lifestyle they have, but it's something to take in consideration. It's their systemic inflammation. It's not only the macroinflammation on the follicle, but also the systemic inflammation on the body. So how stress and hair growth cycle, the cortisol also affects hair growth. So again, as we can see, it's so many different roles that will affect the hair loss that we should be watching for. So this is it's an interesting panel that you guys should actually take pictures if you guys are interested. This is a panel markers that we request for male. So we have all these different blood works, and through that we will identify what is their deficiency before we start treating them, so we could get a better result. And in this case, we have the panel for women. It's a little bit different, but I think it's very interesting for you guys to check that. This is over studies of people. There are specialists in trichology and hair treatments. And so it does make a big difference. There are a lot of studies out there proving the deficiency of these mineral vitamins and hormones, and even casein and gluten antibodies on the hair loss procedure. Okay, so grading of hair loss in men. So you have different classifications. The most important one will be Hamilton in 1951 and Nordwood in 1975. Even though we have multiple different ones, I put it here for you guys to see, but it's important, you know, to pay attention. These are the most important ones that most people follow. So this is, we have a scale from 1 to 7, and you could see how the progression it goes to up to a 7. So it's dramatic, the difference. And this is the measurement and diagnosis for women. So we have 5 different ones. And here we have an example of 2 of them. Okay, so here's the Sinclair and here's the Ludwig scale. So whenever we start a treatment, it's important for us to, again, do the diagnosis correctly, have the right scale for their baldness, take pictures. I am starting now doing, using a trichoscope to take pictures from the scalp because I think it's important, because a lot of times it's very difficult to actually take pictures in the same position with the same lighting. I try to brush the hair always in the same direction, but it's still very difficult a lot of times to get the same lighting. The best part is, like, my clients are happy and everybody are complimenting them that their hair fuller, are actually, some of them say that people come and question if they had dyed their hair. because believe it or not, the hair got darker, and you guys will be able to see in some of my pictures. So these are ways of grading hair loss. So you have ways to evaluate. You have questionnaires, you have global photography, dermoscopic, trichoscope, count, standard tests, washing, biopsy. So it's so many different ways for you to actually do a study. You know, you'd need to identify what will be the best option for you, but it's, I put them here so you guys could have an idea of what are the grading hair loss measurement tools we have. So this is an interesting one. So they put the people to count their hair and compare to the pictures, and they will, you know, grade them from 1 to 4. This is a global photography. This is actually a very professional one, which is probably what it's easier to get the lightning on this one. This is, they count each follicular unit on the hair scalp, which is a lot of work. This is a trichoscope. This device is actually from Canfield. They're just launching it. So their system, their software counts the hair density, the number of follicles. So it's a much precise picture than other systems, but it's a quite expensive device. If I'm not sure 100%, but it's about $12,000 to $15,000, this device. But I mean, if that's what you want to work with, again, I think we need one of those tools. And now that I really start seeing results with the Fotona, the HAIRestart, I'm investing more on this field because all the men want to spend the money. They don't care. They don't question the price. And they come back for their treatment every 2 weeks. Once women, even though, and I'm going to show you guys one of my clients, she actually works in my office. I got one treatment for her because she never comes to do the treatment. So men are great clients on for the hair treatment. So this is a Foley-scope. I got one of those. It needs education, so I'm kind of bumping my head because it's a little hard to actually set it up, but it's a cheaper version of the Canfield. Okay, and then we're gonna go to the therapies. So we have drugs. So mainly the main drugs will be finasteride and minoxidil. We have a low-level laser therapy. We have hair transplant, microneedling, alone or combined, PRP, exosomes, carboxytherapy, ozone therapy, and we have specific shampoos. In my practice, one thing that I do with my clients are I put them in a specific line of shampoo that's made by essential oils, no preservatives, so nothing harsh. It's really specifically to treat first inflammation, okay? And then on the second step, we go to one that will thicken out the shaft of the hair. So what I like about this company, it's a Brazilian company. They're really not worried just with the scalp, but they're worried with the shaft of the hair. So with the quality of that hair that we have. And most people that actually treat hair growth, they don't really care about the shaft. They're just worried about generating, like creating more hair growing, but nobody takes care of the shaft. So this company that I use, I'm very impressed with their products. All my clients got it and they all very impressed with it. And I do also combine with something that is different here, that it's a little laser that goes on the wrist, which is a diode laser that treats systemic inflammation. The original procedure was developed in Russia, and it used to call intravenous laser therapy. And it was modified, and you have now a wristband that you place the laser, And the wrist in adult is for 30 minutes. You could place on the neck, on the carotid vein, and it also will treat your vagus nerve for 15 minutes. And as I'm doing the procedure, have that laser on my patient's arm, treating systemic inflammation. Okay, so here we're talking again about nutrition, diet, and hair loss. So again, I always tell my clients, if you're not willing to change your lifestyle, if you don't spend money with your health, you will spend when you get sick. So let's prevent. And if they're investing, you know, money on a treatment like this, and even if they're investing money on procedures like skin tightening or skin resurfacing, I do tell them you need to pay attention on your diet and your supplementation, because unfortunately in these days, we don't have the same nutrition on the food as our grandparents had. So we need supplementation. So we'll need supplements. So finasteride, this is a situation that a lot of people do not understand the side effects of it. And I have a lot of clients that actually start taking it. And I did question them. I was like, were you advised of the side effects? And they're like, which side effects? And the side effects are quite terrible. And you can see here, reproductive system, circulation, brain, colon, kidney, and behavior. And then we go to the worst problem, side effects on the sex life, impotence, loss of interest in sex, trouble having an orgasm, abnormal ejaculation, swelling in the hands or feet, swelling or tenderness in the breast, dizziness, weakness, feeling like you might pass out, headache, run nose, or skin rash. So my question for them, I'm like, I make a joke. I was like, your girlfriend will not leave you if you be bald, you get bald, but they will leave you if you stop having sex with them. So you got to choose in between your hair or your sex life. Thank God we have other options. We have now the HAIRestart that we are able to treat them without having problems with propecia. So again,
Claudia?
Yes.
Is this a good time? I've got a few questions here, unless you want to go one more slide and we can.
Yes, I'll just talk about this. So this is, again, it's another study showing the permanent sexual dysfunction risk with propecia. Okay, so I'm going to stop sharing here for a minute. Yes, Logan.
Okay, yeah, so we've got a few of the same question, a popular question here about the company in Brazil that you're using for the shampoo.
Okay, it's called Granda. I could give you guys in the end. I think it's important to always give a client something to take home, right? Because you know what they're using home. Most of the shampoos out there have a very unbalanced pH for the scalp, which actually it's being more harmful than helpful for us. So that's one of the choices why I chose this company. So it's called Granda, which, hold on, let me get a little bottle so I'll show you guys. But it's I think it's a very important approach to have them always taking home something. So this one here is the second step we use, is for making the hair shaft thicker. So we start with one that treats inflammation, and then we go to this one that's going to make the hair shaft thicker.
Great, thank you. Okay, so we've also got a question about what brand of trichoscope do you use?
Okay, so I've been talking to people from Image. They are launching, they have an image system, and they're launching actually a software on their image system which I've seen in some companies, the same as I have a Vizia, but I'm actually negotiating with them because you put your head on the support and it takes a picture, and they have actually, they're developing a software just for hair. Yeah, because I bought that one that I was telling you guys, the Folyscope, but it's so hard to make it work. So it definitely needs education. I don't know how we get education from those Chinese devices, unfortunately.
Understood. Markers and blood count. What are we looking for? WBC, RBC, or platelets, or everything?
So as you guys can, I'm going to share my screen here, Logan, just for one minute here so I could go back here. So it's going to be different for male and female, right? But I always ask those markers regardless. You know, if they're healthy, I don't care. I want those markers. So if somebody wants to take a picture of it, in the end, it's going to be my email. I could actually send you guys the levels they should be. So you guys will have it, right? Where is it? Here, oh, all the way back. Okay. So yeah, what I'll do is, if somebody's interested, you guys could always email me and I'll send you the list, and I also send you guys the levels that they should be capped on.
Can you share your email?
Yeah, my email is on the end of the presentation.
Oh, okay.
Perfect. So they will be able to email me, and I will send them the, just guys, when you guys put the subjects, just put Empire Hair Restart seminar. So I know it's from somebody from Empire.
Okay. Then I've got one last question.
Yep.
Kind of about the difference in the YAGs. I think they're talking about, you know, there's an erbium YAG and an ND YAG.
Okay.
Are they the same? What makes one different from the other?
So erbium YAG is more superficial. It's a 2940 nanometer wavelength. Even though it's like a, you know, it's a larger number, it's a longer wavelength, it's a more superficial. The chromophore is also water. It's specifically more water. It's the actually wavelength that has the largest absorption of water on the scale. Compared to a CO2, erbium has more absorption on the curve of water. 1064, you will have absorption of water, hemoglobin, and some pigment. So on the hair restart, there are some practices. They're actually using as well 1064 YAG on the treatment. The Fotona has a different pulse duration and modes on the laser. And there's one specific and unique that's called the piano mode, which is a long pulse. And they're using that to stimulate hair growth. And I have a dear friend in Texas, Logan knows him, Dr. Baber. And Dr. Baber did show me, and one of his legs, he was bald in his leg for over 25 years. And he shined just the 1064 YAG and piano mode. And he was able to make hair grow. It was impressive because you could see from one leg to the other. So yeah, so there are some practices using ND YAG combined with erbium to stimulate hair growth.
Great, thank you. And to be clear, the Fotona device she's talking about, the Dynamis, does have both the erbium and the ND YAG on there. So you have both.
So as you guys can see, there's an arm here. This is all the erbium lasers. So we have different hand pieces and we have different scanners. And the 1064, it's all in cables. So we have two wavelengths here and we have multiple hand pieces. I don't know if you guys could see, this is a scanner. And then we have multiple titanium hand pieces as well.
Great, thank you. It actually looks like we have a few more questions here. I'll try and get through. What supplements do you use? How many treatments are required to see results with the laser? Maybe you're answering these later. So if you are, you can table that to later. Okay. I think I'll hold the rest of the questions until we finish the presentation. because
Okay.
I think you'll answer most of them. So thank you.
You're welcome. So let's go back to the screen. Okay. So we're talking about Propecia. So Propecia in the market, it's actually, there are class actions, lawsuits against them. And they actually had settlements of almost $5 million, which shows like, you know, there is a problem out there and they don't want that to spread, but it is a big thing. So then what another drug we use on hair loss will be topical drugs like minoxidil. You could have scalp irritation. You could have unwanted hair growth in the face, chest pain, fast heartbeats, swelling in the hands and feet, rapid weight gain, lightheaded, same thing, feeling like you might pass out, kind of similar symptoms if you guys notice of Propecia. Headache, dizziness, confusion, or flushing, redness, warm, tingling feeling. So then we do have the low-level laser therapies. We have many of them, very interesting ones, very funny ones. These are listed as the 7 best devices for 2020. Times of treatment is in between 7 and 25 minutes for each. Number of sessions, 3 to 7 treatments weekly, which is a lot. The therapy durations is in between 8 and 48 weeks. And then the hair count increase was from 15 to 19 hairs per centimeter square. So it's a good result. Does it work? It does. But it's a long process. I think should be a process that should be combined to whatever we're doing in the office, for example. They should be using that at home. It will definitely help. So again, that's a study showing the low-level laser therapy for treatment of androgenic alopecia. So it is FDA approved, which means it's safe. Increases hair growth factors producing on the hair follicle, improves cells level respiration, increases ATP production, and the low laser therapy works by increasing blood flow to the scalp and hair follicle, encouraging hair volume and healthier looking hair. So it does work. My only point is it should be combined to whatever you're doing on a practice just to get a better result, because a lot of people, they don't comply at home doing the procedure how it should be. But if they do it, whatever, 2-3 times a week, it will always be helpful. Then we have microneedling devices. This is a few different microneedling devices. There are microneedling devices that I do like. You could use them alone or combine with PRP, exosomes, growth factors. You could use it, there are some places that use with minoxidil. So depending on your choice, you will use it alone or in combination. It does work really well. Microneedling is a procedure that anybody will benefit from it. So then you have hair transplants. So this is a computer that actually chooses where to pick the hair and where to put them. In New York City, this is something in between $10,000 and $20,000 a procedure. One of my clients, which I'll be showing you guys his picture, he did about 3 years ago. He was put in Propecia, and I spoke to him about it, and he decided to drop the Propecia. And actually, he got a better result with, I have in 2 different pictures on the presentation, one after 3 sessions and one after, if I'm not wrong, 6 sessions. And you could see the difference of them. And he got a better improvement just with the Fotona alone than with his transplant. And we're gonna get there, but until the 3rd session, I only use the Fotona. After the 3rd, it's when I added the laser to treat systemic inflammation. Okay, so this is talking about silicone deficiency, physical signs and symptoms, hair loss, brittle hair, thin of hair. So just showing again how important certain supplements is on the hair health. So we need to give our body those tools to build a healthy tissue, including hair. So these are two devices from Fotona. So on the left side, you guys have the Fotona Dynamis, which is this guy here. And then they launched the Time Walker, which is the baby version of it. It does a lot of similar things than the Dynamis. The only difference is it won't be able to use scanners like we have here and do body treatments like the Dynamis is able to do vaginal rejuvenation and the Time Walker does not. But the size of the devices is much smaller as well. So if people don't want to invest as much money and they have space problem like we do in New York, it is a great option. But when I bought the Dynamis, I bought it because I also wanted to do body. So I wanted to do vaginal and I wanted to do the tight sculpt. So, and I wanted the scanners. So that's why I got the Dynamis. But you guys have an option of the Time Walker that was just launched. I think it was a year or a year and something ago, but it's a really good option. Okay, so Fotona started with hair transplantation many, many years ago. They had a patent on that. A patent probably expired by now, but they were the first ones, as we could see here. That was 1999. So what they used to have, it was a handpiece that it was called the RO8, and they will do is they will open the scalp and put the hair, versus if you go with the needle will just spread the tissue. And if you go with a CO2, you will just cauterize and vaporize that, and there will be no blood supply to feed that hair. So as you can see, the results are pretty good. This is after one. Sometimes they do a second procedure just to make it fuller. And then we came to the smooth mode, which is the hair restart, which is an epidermal superficial thermally activated regeneration of tissue. Okay, so smooth mode is a fractional non-ablative treatment. Currently over 50 practices in the US use Fotona erbium. Laser protocol alone or together with PRP, stem cells, injections, exosomes, and or supplements. Average price is about $400. I charge in my practice $600 individual, or I charge 6 sessions for $3,000. I can tell you that they pay so happy. And the way for me to catch them is like, I got my clients that were like my loyal clients that have been coming to me for many, many years. And I said, let me try the treatment with you on you. If it doesn't work, I'll refund your money. They're actually past the 6th session. They're like, I want to do more. But it's like, it's very rewarding to know that you're really able to deliver a result to your clients that's like, they couldn't be happier. So one of my clients used to come for hair removal. He started doing the hair restart. And it's funny because now he calls me, he's like, no, I don't want to go for hair removal. I just want to go for the hair restart. Which, you know, for me was good because it's more money. And he's happy. He's like, he couldn't be happier with the results. Average 75% restoration by volume. If clients has been balding for less than 8 years. I do have a case that I start treating, and hopefully I'll be able to update you guys in a few months, that has a alopecia universalis, like completely bald. And I did all the blood work on her. I'm starting supplementing her, and I start treating her. And hopefully we will get a result. She's been bald for over 10 years. So she does have immune conditions. She has vitiligo. She has a hysterectomy done 10 years ago. That's when she lost her hair. So hopefully we'll be able to get some result out of it. And I'll be very happy to share that with you guys. So what we're doing, we're stimulating regeneration and rejuvenation of the hair follicle. This started over 10 years ago with a training to lift the forehead. So Fotona has a procedure that's called a 4D, which we use 4 different techniques to treat skin tightening. We treat intraoral, so that's the first step. And then we treat 3 extra steps outside. So there are 2 steps with erbium and 2 steps with Nd:YAG. The intraoral is with the erbium. It's the same smooth mode that will treat hair, that will treat snoring, which is another unique thing of Fotona. Again, off-label and processed with the FDA, but it does work. I tried myself, so I can tell you guys. It's also mode used for vaginal rejuvenation. And then we go to 2 steps of Nd:YAG. And then the last step is a light peel that we either could do with the smooth mode or we could do with the full beam. And what happened is they were trying in South America to lift the forehead with the erbium. And they start seeing improvement on the hair quality, the thickness, and the volume. So that's how everything started on the hair restart. So Fotona smooth mode, fraction, no ablative treatment. How can we optimize hair health? Provide the body with key ingredients for a healthy tissue. Supplements, nutrition, again, very important. So what we doing? We increasing blood flow and lymphatic circulation. By using erbium YAG smooth mode, we create a thermal injury, introducing a fast heat shocking that increase blood flow, producing a heat shock protein and fibroblast creation. Stimulates cells to produce cytokines, growth factors. At the same time, through the controlled warming process, we are releasing cytokines, THFB3 and EGF growth factors, triggering the epidermal cells to stimulate the hair growth, regeneration, and creates rejuvenation. And also we improve this the epidermal turnover. So what we are being able to do with the Fotona smooth modes, it's really angiogenesis and vasodilatation. So these are 5 steps that's needed for hair growth and rejuvenation. And we are able to achieve both of these two, like these 2 with the smooth mode. So we are also able to, with the signaling are the group of transduction pathways, which being with the protein pass, signaling into cells through the cell surface receptors, is known as regulated stem cells pluripotency, which means is that those stem cells are able to create different cells, not only one, but different, even hair cells, which is very, very interesting. And then in the end here, we have a comparison of laser compare with different procedures like minoxidil combination, but here we mark exactly laser, which is here, and minoxidil. And if you can see, we got a better result in the study with lasers, with 2940 erbium. So conclusion, it's important to addressing nutrition and hormone deficiencies. Pain is less than 3. Cooling is not needed. It's not painful at all. All pictures used with permission. Only Fotona smooth mode was used. No additional modalities like PRP or stem cells. Like I mentioned in some of my protocols, I did use the laser and I did use the shampoo. Supplements were added after, which I don't have the pictures yet. Okay, so here we go, the first one. So it's a 64-year-old male, alopecia stage 4, skin type 3. So this first picture was post 3 treatments. This is the client I told you that had the hair transplant. Second treatment was 2.5 months, so we did 1, and then 2.5 months later we did another session, and then the third one 2 weeks apart. And then here, it's actually after 6 sessions. And you can see the difference. The hair looks darker, fuller. His hairdresser is impressed, is actually sending me clients because they're like, I never seen something like this. So it's quite impressive. On here, just Fotona. Here, on the last 3, I add the laser on the wrist, and the shampoo was used since the beginning. This is another client of mine, 48-year-old male, alopecia stage 3, skin type 3, post 5 treatments every 2 weeks. And after the 3rd, it's when we added the laser. It's called E-Leap. So you guys can see like big difference. Very interesting. As I start treating this patient, we need to treat the scalp. For me to get to the scalp in the front here, in the last 2 treatments, it's been difficult. So full his front got. Every friend of his are like complimenting him. It was like, what did you do to your hair? And he was actually, he wanted to do a transplant, and he was on Propecia and he stopped. So I'm very happy that I was able to help him when he was able to drop Propecia. So this is one more client, 44-year-old male, alopecia stage 5, skin type 3, after 3 treatments. He came every 2-3 weeks. He's been on the shampoo, and after the 3rd session, I used the laser on his wrist. This is actually our front desk here. She's the one who was able to do 1. So that's what I'm saying. It's like women are not as compliant as men to do hair loss treatments. That's my feeling. So she's a 34-year-old, alopecia stage 5, skin type 5. This is after 1 treatment. It was 1 week apart. So it's quite impressive just for 1 session. Okay, this is a case from Philippines, Fotona hair growth protocol. That was Benita's first case. So you can see a big difference. Quite impressive, the results. Then we have Jeff, that was one of the started sharing the protocol. Lori, another impressive result. And this is 4 to 5 sessions. And on one thing that I do different, guys, here is, if you guys can see, and like most of you guys don't understand about the procedure, but I figured out that last energy is better. So my energy, instead of being 7.75, I use a 6 joule energy, because I believe you're doing more photobiomodulation than really like you need that high energy. So, and I've been getting great results with 6 joules. So I'm keeping the 6 joules. I'm actually even thinking about lowering it to 5.5 to try. So here's Amanda post 2 weeks after 5 treatments, 45-year female, alopecia stage 4 and skin type 1. Again, Amanda, post 2 weeks after 4 treatments, 36-year-old male, alopecia stage 3, skin type 5. Dr. Martin Garcia, 44-year-old, alopecia stage 3, skin type 1, post 2 months after 5 treatments. Very impressive. Dr. Shabam, post 2 weeks after 2 treatments, 53-year-old male, alopecia stage 5, skin type 3. So as you can see, guys, it's not 1 picture, it's 2, it's many, it's dozens of pictures. I picked some of them because they're like authorized to be used, but it's so many pictures out there of practices they're be doing it, and it does work. So Jen, this is before and after 3 sessions. This is Dr. Doris Day. Dr. Doris Day she's a dermatologist here in New York, having great results. This is after 5 months, and this is a 6 months after 6 sessions. 4-year-old female, alopecia stage 3, skin type 2. This is the most impressive one. The next one, guys. This is my case that's coming soon, hopefully. So it's alopecia universalis, and look at the results. I'm not sure how many treatments she had so far until here, but it's impressive. This woman had no hope, and look at that. It gave her confidence back, I'm sure about that. It's life-changing. And this is one of the reasons why I like this procedure, as well as the snoring. It's just life-changing for people. It goes way beyond aesthetics and look. It's life-changing. Is your confidence back? And I don't think it has a price for that. And these are the 2 babies. So this is the Dynamis, SP Dynamis, and this is the Time Walker. So you guys have 2 great options. I am very happy to have added Fotona to my practice. It took a little time, but I got it. And thank you guys. My email is here. If you guys have any question about the markers, the supplements, I could always send you guys. And I hope I will be able to help you guys in anything else you need. And I was able to inspire you guys to change lives and give back people their confidence that they lost. Okay.
Awesome. Thank you so much, Claudia. That was a wonderful presentation. And we've got a lot of good questions here. I'm going to try and go through as many as we can. We'll start here. Could you share the parameters with us? The energy, the number of passes that you're doing?
Yes, I can. So I'm doing the smooth mode and 6 joules, right? 7mm spot size. And I'm doing 3 passes. Okay, so it's 1, but I do like Jeff used to count. So I do a cross hatch as 1, right? So I do 3 passes, which if you count one way will be 6 passes with the energy of 6 joules. And I did notice less energy is working better.
Okay, so you're doing it back and forth as 1 pole.
Yes.
Okay, I misunderstood you earlier.
So what I usually do is I go back and then I come on the cross. So I come in a cross hatch.
Gotcha. 1
and then back. Yeah.
Okay, perfect. Thank you. Any side effects of laser for hair? Can you do a quick comment on microneedling, PRP versus laser? Here. Okay,
so laser, the only thing that some clients reported, and their scalp gets a little bit dry because of the erbium, right? Nothing else. Microneedling, like I said, it's always good, but this is so fast. Microneedling, you're gonna usually you need to numb the scalp because it hurts. It bleeds a lot, right? You have consumables. So you have the whole setup for contagious disease. So it's like, it's a whole preparation, but it's a great result. I love microneedling. It's just like, I chose this because it's a procedure that takes 20 to 30. John, I think we can hear you. So the procedure is like very, very easy. There's this client that I was telling you guys that is alopecia universalis. I wanted to make a trial on her, which I want to do on half of her head only, adding exosomes to it. But I'm not doing the full head with it. I'm doing half of the head just with the laser, and I'm gonna do the other half with the exosomes, so I could see the difference of it. Exosomes are being used for a lot of doctors that I know. It's been working great. So that's why I thought about maybe adding it for a case like this one, which is a alopecia universalis. That's kind of, she's been bald for over 10 years. So if I can make hair growth there, and hopefully we'll be able to help a lot of people out there.
Thank you. I'm trying to dive through all of these. I'm getting a lot of congratulations. You did a great presentation. So clearly, thank you so much, everyone. I think I really appreciated it. Email again. If you could maybe show your email again real quick as I look at their questions here.
Have it. Okay.
Okay, thank you, Claudia. How often are the treatments required to be done to maintain the hair growth?
I like to do it every 2 weeks apart at least. I did try in some clients once a week, but it's very hard to get them into the office. And I think in 2 weeks, you're able to see a little bit more of the results. So I like to do it every 2 weeks apart.
Okay.
And it doesn't mean they lose it if they wait 3 or 4 weeks, because my first client I show you guys, I treated him back in February before COVID, actually March. And I only went to treat him again in June. So it was kind of a long time and we didn't lose anything. It was actually, I could really see the difference.
Gotcha. Okay.
Logan, let's go ahead and remind the attendees that if we haven't answered your question, just send an email to Claudia and Claudia will be able to answer them, just in case if we skip your question.
Absolutely, please. Yes, take down Claudia's email. You can email her. You can also email me if you have any questions about us at Fotona. My email, just speak it out for you. It's L as in Logan, R-I-I, so igloo, S as in Sam, E at Fotona, Fotona.org. And there are a few more. Gosh, we're not going to be able to answer everyone's questions tonight, but there are a few more.
I'll be happy to answer all you guys.
Perfect. Thank you so much. Real quick. Oh shoot. Oh gosh. They keep coming. Can you elaborate more on the skin type and implications for the treatment? Does skin type matter when you're doing this treatment?
No. So you can do any skin types. Remember, the chromophore or the erbium is water. So we could do any skin types. That is, again, the beauty of it. So we are able to treat African Americans, especially the ladies that use a lot of wigs and they get bald in the beginning here. So I start treating some of them. I don't have the results yet, but I'll be able to, soon to share with you guys. But yes, we are able to treat all skin types with no side effects.
Great. And what else can the laser treat? You said it can do a lot. I've got a question here.
Okay. So the Fotona, what really, the device comes like this, and depending can you see the machine, Logan?
No, if you can stop sharing your screen now. I think everyone should have written this down. If you haven't, write it down now.
Okay, so the machine here, like I explained you guys before, the arm is the erbium, the cable is a YAG. So we have multiple hand pieces. This is what we call the R33. So this attached is actually a thermometer. So in certain treatments, like for example, the piano, which will be similar to a Genesis from Cutera, that we're heating the area, instead of I'm getting a gun and measuring the temperature, this blinks right here. So it blinks to red to yellow, to green, yellow to red. So when it's in red, I set up on the machine what temperature I want. Mine is set up for 40 degrees Celsius. So just from blinking, I know I got there. The machine, the screen also shows it. These are different hand pieces which would deattach. So I have 3 different hand pieces. You have multiple ones. So you could have on the R33 up to 10 millimeter spot size and as small as 2 millimeter, right, Logan? Because I have 2 to 9. And then you have what they call the R34, which is a larger one, which has a 15 and a 20 millimeter spot size. And then we come to the scanners. So we have the scanners, which is this one. So this scanner, we are able to treat hair. We are able to treat skin tightening. Okay, so we have different modes on it. We have the frac mode, we have the piano mode. So depending on the procedure we're doing, we combine them or we use them separate. Both of these hand pieces will treat hair. Okay, and then we go, this is the only scanner for now that I have, right, Logan? Try to negotiate the other two because they have very unique scanners. So then the hand pieces come all in little boxes like this. They come like this. So these are the hand pieces. They're titanium. You can autoclave the edge of them. Okay, so this is a fractionated erbium handpiece. So it fractionates the beam. It's what we call the FSO1. So that's one that I use a lot for scars, stretch marks. It's fantastic. And then this is the PSO3. This is the one that we use for the scalp. We use for a procedure that's very, it's very hot in the moment. That's called the lip lace, which a lot of laser companies are trying to copy, but the original lip lace is actually from Fotona. So we treat intraoral, the mucosa, and we treat the lip, and we use the PSO3. So PSO3 we use for lip, for snoring, for the intraoral part of the 4D, the vaginal. So the vaginal, we use the external, this one, and internally we have a scanner, or, which I don't have yet, hopefully soon, we have the prompts. So we have two speculums on the vaginal. These connect here, right? And this one has a mirror, as you guys can see, and this one shoots 360. So what happened is we have a disposable speculum that goes inside the vaginal canal, which is this, and then we introduce the handpiece. So it's more comfortable than a lot of other procedures in the market, because the others, you will twist the entire speculum. In this one, you don't move it. You just twist the handpiece inside. Okay, so this is the vaginal. And then we have the full beam, which does a full resurfacing. I've been treating a lot of keloids actually with it, scars, which is this one. So PSO3 is red, R11 is blue. Okay, so that's another key handpiece. I think like I have the key hand pieces that will be required, in my opinion, that you guys should definitely have. It's just like if you, for example, are not interested in doing vascular, you could get like the R34. However, when you're doing the 4D, it does make a difference on certain areas with some of the settings. On the frac 3, for example, I treated myself with the 4mm because I can't treat myself with the 9, because you don't want to cool the area down. What we want is to really heat that area and keep that heat there. So when we're doing erbium, we never want to cool it down. When we're doing 1064 YAG with the scanner, we could plug on the back of it, like we could plug here the Zimmer. So as we're treating, this is blowing air coming from here, as well as on the scanner, it blows air as well. So when we are treating skin tightening on the body, for example, it's connected right here. We heat the epidermis, and then after the epidermis, we hit temperature, we could plug in the Zimmer, because that's going to keep stacking pulses deep into the dermis without being uncomfortable in the epidermis. So it's a very unique technique, the scanners that they have. Yeah, I'm looking to negotiate 2 of them, the vaginal and actually the T-runner, which will be the equivalent to the PSO3 on a scanner.
Thank you so much. I've got 2 more questions, and then we'll have to stop for tonight. Again, hopefully you wrote down Claudia's email address so you can reach out to her. You can also reach out to me. There have been a lot of questions about the pricing of the device and what the investment cost is in this, and feel free to reach out to me. I'll be happy to put you in touch with the representative in your area. We do have a summer sizzle special going on throughout August, we actually have an option as low as under 80,000 for the machine, with all of these different options that she's talking about on the Time Walker. And then of course we can, as you can see, it's very customizable. So please reach out to me, and I can put you in touch with one of our representatives, and they can give you more information on that and what all that entails. But real fast, will the Fotona work for other types of hair loss? For example, female pattern hair loss, or African Americans who braid their hair might be having.
Yes, that's what I start doing some of them. Yes.
Fantastic.
But again, a lot of them is for traction, right? So what we need to educate them is like, okay, I can make your hair grow, but if you keep putting traction on it again, she's going to lose it. So it's the same as I usually tell clients when we're doing nail fungus. I can treat your nail fungus, but if you don't treat your shoe, you're going to recontaminate your nail again. But yes, we can.
Great. And lastly, now I've lost it, but I believe the gist of it was, you know, typically we think of hair or as lasers for hair removal. So what makes this, you know, now we're kind of thinking about lasers in the opposite sense, which is a little bit, you know, counterintuitive. Okay. Can you explain that a little bit before we go?
So laser can also, it can destroy and it can also regenerate. Right? It depends on the energy level that you put, the pulse duration that you use. So that's the beauty of this is Fotona was able to develop a pulse duration that was not as aggressive. So you guys that works with laser probably noticed that some clients will come back and complain. I was like, whoa, but after I started doing laser hair removal, I got more hair. Because probably the setting was too low. So instead of killing the hair follicle, you're actually stimulating the hair follicle. So in this case, is the pulse duration is the secret, the wavelength, but more than anything is the technology of the pulse duration.
Well, thank you so much, Claudia. Really appreciate it. Really appreciate you having us back again, Sean, and hope to see you all again very soon. We'll actually, I guess, be doing this again next Tuesday night.
Yes, we have another one next Tuesday. Yeah. Next
Tuesday. So please join us. It'll be with Dr. Doohee Lee again, speaking on innovative and new laser applications with the Dynamis, but some other things outside of the hair growth. He'll be talking about more or other aesthetic procedures and medical procedures he's doing. So hope to see you there.
Sure. And guys, Logan is the best.
I'm the best too.
Yeah, best on something else, okay? I was just saying, like, to negotiate, she's the best on lasers. You're the best for the training.
Right. So thank you, everyone. Thank you, everyone, for joining us. Thank you, Claudia. Thank you, Logan. It was amazing as always. And next Tuesday, we're going to have another amazing webinar with Dr. Lee. So don't forget to register. And if you have any questions, if we haven't answered your questions, please send an email to Claudia. She's very good at it. She will answer all your questions, and also Logan. So thank you so much for joining us tonight, and everyone stay safe and have a good night.
Thank you, guys. Have a good night.
Thank you, guys. Have a good night, everyone.
Bye-bye.
Bye-bye.